Hi, my name is Awesome Aguilera, and welcome to WEYT, the show where I find interesting people just like you and discover what's going on between their ears. Now, let's get to know one another. What's up, everybody? Awesome Aguilera, and welcome to another episode of WEYT. Today's mantra is, you can be in charge, but never in control. And that was said by somebody anonymous, but that's a really deep one if you really take a chance to really go into the layers of it. Because right now with this COVID, with riots, with racial tensions, we don't have control over any of that, but we are in charge of how we respond to it. I have another wonderful smiling face, and this is Dr. Tom Bachar. How was that?
Not bad. We'll work on that Israeli accent.
I need to work on it. I want to be a polyglot. So, this is, I can start right here, right now. So what is my relationship with Dr. Tom? So I know Tom as Tommy. I knew her since before she was a doctor. And I can tell you the very first time I even noticed Tommy, it was at an Orlando Salsa Congress a few years ago. She had flaming red hair. And there was this little tiny ball of energy that shut the party down. It was like 5, 6 in the morning, like 10 people left, and she was in the middle of the dance floor shutting it down. Throughout the years, I've built a fantastic friendship and relationship with Tommy, hold very close to my heart. And that's who Tommy, as we call her, is to me. But let the people know more about who you are, Tommy.
God, what a question. I feel like when people ask me that, my immediate reaction is like, I feel like I have so many different facets to my identity that it's like, where do I begin? As Flip said, he knows me as Tommy, but in my professional world or in my birth certificate, my name is Tom Bachar. And now I have that doctor in front of my name, which is weird to say. I still haven't like fully sat into that title since it's literally been a year ago to a couple days ago since I graduated. So it's very fresh. I was born in Israel around the Gulf War in 1990, December 30th, 1990. And that was right when the Gulf War was happening in Israel. So that's something, fun fact, that a lot of people don't know about my history. And due to the war and due to the climate in Israel, my parents decided to leave after about 2.5 years. So I moved to South Florida, Coral Springs, when I was 2.5 years old. And I've been living here ever since, with the exception of 2 times in my life. The first time was when I moved to Orlando for the University of Central Florida for my undergrad. And then the second time was for my internship in my doctorate program when I moved to Columbia, South Carolina, and I lived there for a year. But other than that, I've been a South Florida girl. There's a lot of other dynamics to me, but I can go on and on. I don't know how much you want me to share.
Well, just tell the people what kind of doctor you are.
So I'm a doctor of psychology. I have a PsyD. And I specialize in human sexuality and working with the queer community. I do work with people with all kinds of presentations and disorders, but that's mainly my passion, is human sexuality.
And what drove you to want to become a psychologist?
Oh, the golden question that everybody asks. Honestly, I think there's a phrase, what is it, that I was born to do this. Like it's not so much that I looked for it, it's that it found me. Like I just always was interested in humans, and ever since I was a little girl, like I would be that 3, 4, 5-year-old in the room talking to all of the adults instead of kids my age. And so it kind of just was my identity from a very young age. I just always was intrigued by human behavior, and I asked a lot of questions when I was little. And then when I got to around middle school, I knew about that career path, and it was just kind of, we always knew like Tom's going to be a therapist. And when I got to high school, I took the AP psychology course, and I just knew that when I go to college, that's what I'm going to pursue. So it was a very kind of natural and authentic fit from a very young age.
Awesome. Well, thank you for sharing who you are and what you identify as at the moment, at least on this small little aspect. But now we're going to get to know a little bit more about you as we ask you, what's engaging your thoughts lately?
You and these vague questions. I have so much. Being
Yeah.
a psychologist, I mean, I have so much engaging my thoughts at every moment of the day. Everything from obviously the current political and social justice climate that's in our face and the pandemic, all the way to my personal life and the transitions that I've been going through in the last year or so. So I think that second piece is probably really taken over my mental and emotional state, is all the different transitions that have been happening to me. So as I mentioned before, I went on an internship to Columbia, South Carolina for the last requirement of my doctorate program. That was a very new and exciting experience for me, where I got to move out of my parents' home for the first time outside of college. So obviously in Orlando, I lived with roommates and I lived in the dorms. But this last year in South Carolina was the first time where I got to live in my own apartment that I was paying for and getting a paycheck to pay for it. So that was mind blowing on so many different levels. I grew as a person, I grew as a psychologist, I grew as a sexual being, I grew even in my non-psychology work life. So I even got a bartending job and got to get a flavor of what that's like. So there's a lot that happened to me in that year that really progressed and developed me as a person. And having come back from that, moving back home into my parents' home in July, so it's going to be a year almost, July of 2019, everything kind of shifted, as you can imagine. And it's felt a little bit like a regression in the sense of, you know, being under my parents' roof, not having that amazing independence that I had in South Carolina, and trying to build a new practice for myself and build a business name for myself, along with some romantic relationship ending as well. So there's been a lot of different transitions in a condensed amount of time. And I think that although it's been very difficult and challenging, I think that we grow most from our most challenging times in life. So I'm nervous, but very excited for the changes that are happening to me right now.
Okay, so I wrote down here, just to circle back, what is it that you think you learned from having that bartending job in South Carolina, which is a place that, you know, you are not used to? It's a different style of person in South Carolina than in South Florida.
Shout out to Corey, my old boss and manager who got me the job. So I'll tell the story of how I got it because I think it's really relevant and awesome and very reflective of my life and my personality. I'm a very adventurous person, and I've been called a lone wolf before because I'm known to go on adventures by myself. And so obviously I'm in a new town and I want to explore it. I want to meet people, and I meet a friend by going out to a club by myself one of the first weekends that I'm there. I meet a friend, Casey, shout out to you, love you. She tells me about this restaurant who just started having an EDM night, an EDM DJ. And I told her that I love house music. So she tells me about that night. And I go there one night by myself in my little jean overalls, which I would never do in South Florida, because bars and clubs in South Florida, you got to be in your heels and your tight mini dresses. So I waltz in there in my overall jeans, my Converse, into this fancy Korean restaurant bar, and they have house music playing, and I'm already like loving the vibe. I sit at the corner of the bar by myself, and this awesome bartender comes to me, and he's super nice, welcoming me, gives me like free what is the, I'm losing the name of the shot, the Korean, not yuzu, not uzo. I can't remember the name of the shot.
Kamikaze?
No, so embarrassing. It'll come to me. Anyway, so he gives me shots. He's cool. He's welcoming me, and I tell him about myself. And long story short, I go there every week by myself to see these house DJs play, and I start building a relationship with these people that are there, that work there, and the DJs. One of these weekends, I'm kind of cleaning the bar because I'm like a little anal when I see like a spill or something happens, and I'm like, oh, that's obnoxious. So I start cleaning the bar, And the bartender, Corey, he's like, "What are you doing, Tommy?" And I'm like, "Oh, it was bothering me. I wanted to clean it." And he's like, "Huh?" And I was like, "Yeah, I mean, I've always kind of wanted to be a bartender." And he goes, "Well, what are you doing this upcoming Tuesday at whatever time he said?" And I was like, "Nothing." He's like, "Want to come train?" And I was like, "Hell yeah." So that's how that started. And that's how I got that job. And honestly, it didn't last the whole time that I was in South Carolina. My therapy job schedule was kind of conflicting with the bartending job. The bartending job wanted me to arrive earlier than I could. So I only lasted for like a few months, but it was an amazing experience. And what I learned was a lot about the difference in culture in the South, in South Carolina and South Florida. People aren't as rowdy, I guess, in South Carolina. People aren't as diverse. There's more segregation there. Yeah, it was a very different energy. I think what I learned about myself is that I thrive in situations where I can converse with people and dance and move my body. Why I bring that up is because we had one night where there was like a block party where our bar was at. And that night I got to bartend out on the street where there was a big DJ and like a whole block party. And that night I shined. Like I was able to like pass out beer and dance and do all that while I'm serving. Whereas inside of the bar, all the months that I worked there, I had to like make really nice cocktails and be very precise with all the measurements. And that was a lot slower paced and a lot more like a focused type of serving job. And that didn't jive with my personality as much. I shine much more outside in the block party where I got to just serve beers quickly and talk to people and dance and move around. And so even that was cool to see like, oh, this is my strength. This is not so much fitting my personality. And it was really cool.
So is there a way with your therapy that you're doing now that you can incorporate more of movement, more of who you are, and also still get to touch people, or maybe you get a demographic of people that also connect in that way? Have you thought about how you can bring those two things together?
Have I thought about that? Only for several years. Yeah, I mean, I've been a dancer since I was very young. I'm a mover. I have a lot of energy. And so I've always thought about that. I'm like, how can I fuse my two favorite things in the world, helping people and movement and music? And so there are multiple different avenues that have already existed for that type of work. So there's a degree called dance movement therapy, DMT. Funny, DMT. And so there's that route. Like I can go and get a DMT degree. There are people that work as psychologists or therapists without that degree, and they still infuse movement and music into their sessions. So I've done that before. I've had patients that I've worked with that are either dancers or musicians bring in their pieces, or we've done really cool, what we call in the psychology world, experiential work, where instead of just talking during the whole session, I actually have the person act out either their trauma or an experience or whatever it is. And that way you tap into the emotion a lot quicker. Like when you're telling somebody, I want you to treat this therapy room as if it's your family dining room, and I want you to sit in the place where you would normally sit, or I want you to sit in a way that reflects your emotion when you're at home with your family eating dinner. I want you to show me the positioning of your body, of how you feel when you're sitting there with your family. And I had one of the most amazing sessions I've ever had with a woman who did that. And instead of sitting in the area of the dining room table where you would sit, the metaphoric or the symbolic positioning that she put herself in was all the way in the corner of the room, slouched down. And I actually had her position me to represent her so that she can see what it looks like. And it was one of the most potent sessions I've ever had in my life. It was incredible. She wouldn't stop crying, and like I felt lonely. I felt that emotion that she must have felt, when she's at home with her family. So there's a lot of different, I can talk for hours just about that piece. So there's a lot of different ways to infuse the two, but I'm still brainstorming. It's going to be an ongoing like work in progress.
How do you get somebody when they're reliving something like that, where they're going to the corner, where they're obviously feeling cut off? What is the way to interrupt that pattern of cut off or loneliness and start to teach them how to heal themselves.
It's funny that you use the word interrupt. Like I had like a visceral reaction when you said that. And I think that one of the things that I've learned in my training is that well, depending on what modality, what orientation you come from, but for me, the word interrupt doesn't resonate as much as working through or healing through that. So I'm not so much like cutting it off or stopping it, but I'm allowing all of that emotion that, in this case with this woman, that she'd been harboring for years, that she wasn't allowing it to come to the surface. I'm allowing that to exist in the room, and we're bringing it all up and out of her so that she can essentially purge it out and process it and give it appropriate and safe space to understand it and work through it and move through it. So we're not interrupting it, but we're working through it. And if I had to sit here and explain all the different types of therapeutic interventions that I would do after that, it would take us several hours. But if I need to condense it,
maybe even a lifetime.
Yeah, exactly. And so that's why when people have me talk about therapy, I'm like, God, there's just so much that I can explain. And that's why it took me 10 years to go to school. And so, yeah, you really work through it. You talk about it, you milk it out as much as possible. There's no quick fix. There's no like, stop thinking it, stop feeling it. To the contrary, you're trying to pull it all out of you so that you can look at it and be like, oh, that's what it is. Okay. Do I want to keep that around? Do I want to shift that a bit? Do I want to completely change that piece of me? Like, you really analyze everything and then you decide what you want to do with it.
Awesome. Well, I keep doing what you're doing and trying to make the world a better place. I did want to circle around to, you specifically said you work in like sex therapy. The queer community is what you really want to focus on. What is driving you towards wanting to get more into sexuality and like the queer community?
Also a question that I've been asked so many times. To be honest, the main thing that pops up when people ask me that is my dad. And no, it's not in a fucked up, weird daddy issue way. To the contrary. I grew up with a father who is very unconventional in his parenting, in the sense that he's super open about everything. Like there was never anything that I felt growing up that I couldn't ask my dad about. And the reason that I felt that way is because he modeled for me this openness. So for example, I knew what gay meant when I was very young. Like when we went to a trip to Orlando one time in Disney, there was like gay pride. And I asked my parents, I'm like, oh my God, mommy, look, two guys holding hands. What does that mean? And they explained that to me in a very respectful and educational manner. And it was always okay to have all these different identities. My dad showed me and my siblings educational porn when we were young. And my dad showed me what a condom was when I was probably in elementary school. And so I'm really one of the few fortunate people that have received some form of sex education from my parents in a very mature and appropriate way. And so when I would go out into society as a young kid and I would see that like all these things that I was learning at home were not openly talked about out in the real world or in the social circles, it kind of made me like turn my head and I was like, like people are embarrassed about these things. People are ashamed about them. People don't love themselves or don't love certain aspects of themselves. Sex being a huge aspect of ourselves, even as a young kid. I remember that I was masturbating from a very young age. And not that I necessarily only attribute that to having open parents, but I think I'm probably on the hypersexual side just naturally as a person, like genetically or biologically. I'm probably just in general a more sexual person, but
that doesn't mean everybody needs to go give your DMs. Don't slide into her DMs.
Oh my God, that's funny. I keep thinking, don't run into my DM.
Don't run into my DM.
Yeah, I'm very open about it. And I saw that there was a need in society for people to feel validated, for people to feel free and liberated with it. For some reason, I've always been a gay magnet. Like gay people and just people that are different or ostracized in society, like they gravitate towards me and I gravitate towards them. And so I've had this experience of being told, like in private, a lot of people's like coming out stories, or I might have been the first person that some people come out to about certain things, not just being gay, but other identities. I just kind of, again, like the way I described earlier about naturally fitting into this role of therapist, I've just always been that person that people come to and share their like taboo things. And I love it. I love it because I get to be a safe place for people to feel authentically them and to feel like it's okay to be X, Y, and Z. So yeah, that's what draws me to it.
So we've been to several types of, to piggyback off what you're saying, we've been to several discussion groups at the Wilzig Erotic Art Museum, or World Erotic Art Museum as it was known. And I remember that there was this one day where it was just the topic of queer. What does queer mean for you?
Oh God, that's such a challenging question. I want to put that out there, why it's challenging for me, because I don't identify as queer. Even me having to sit with the question of, am I an ally or am I part of the community? Even that's been an awkward thought, because I don't think I'm 100% heterosexual, vanilla, monogamous. Like I have variations of those identities that fall within, I guess, queer-ish. There's a Netflix show called Black-ish. So sometimes I do feel queer-ish, and it has to do with my gender expression, not my gender identity, my gender expression, the way that I express myself. Sometimes I do feel more stereotypically masculine in the clothes that I choose to wear, the way that I do jewelry, hair, makeup, all that kind of stuff. And so I think the bottom line from what I've heard from people that do identify as queer is that it is so personal and individual to them that it's not one size fits all. Now, some people I know use the word queer to equate to LGBTQIA+. Like, those are interchangeable terms for some people. I know that queer historically used to be a derogatory term to refer to gay people or people in the LGBT community. And so what I've heard more recently is that the community has reclaimed the word queer as an empowering word to refer to themselves and not a derogatory term. So there's a lot of different nuances to that word. I have some clients or friends that could consider themselves both queer and lesbian and whatever other identities. So it's not to me as one size fits as the word like gay. Like queer to me is more ambiguous.
Like an umbrella term?
Yes, but it can also be used for an individual person. It can be used as like, this is what queer means to me. So one of the best pieces of advice that I got from a supervisor back in South Carolina is, when you're working with a patient, ask them, what does queer mean to you? How do you identify as queer? Like, describe that to me. And I think that's really kind of ties it all together.
Awesome. Well, thank you for sharing all of that. So now we're going to move on to the next part. And our next question for you is, who would you like to speak to, dead or alive?
God. I'm so indecisive. I mean, being a psychologist, of course, I would fucking love to talk to Freud and honestly watch him do a line of cocaine with his cigar and like chat with him, like just fucking talking about daddy issues and mommy issues and Oedipus and all that fun stuff. I think that would be super fucking cool.
Yeah.
I mean, he is the father of psychology, so that would be awesome. And the second thing that popped in my mind was Stevie Wonder. I freaking love that guy. He's a musical genius.
Yeah.
And I'm obsessed with music. So those are my two worlds, psychology.
So what do you think, like when people bring up Freud and they're like, oh, well, he got so many things wrong. What do you think of when people say something like that?
Eye roll. Yeah. Like, no fucking shit. I'm sure Einstein and Newton and all those motherfuckers got stuff wrong on their first 10 billion tries until they became epic names in history. So, I mean, I try not to be defensive, but it comes up because I'm like, come on, you got to give the guy respect. Like, he created a whole path and a whole bunch of amazing concepts for us to build off of. Was he inaccurate or wrong or whatever, not fully there about some of them? Sure. But we have to start from somewhere.
He was
You know?
human.
Exactly. He's not God. I mean, yeah.
That can be discussed right there. Some people think all of us are God.
Right. And that's a whole
Yeah,
other
that's a whole other discussion.
podcast.
That's a whole other podcast. Aside from Freud, what are some of the top resources that have inspired you?
Dance and music is like my heart and soul. I consider them just like such a huge part of who I am. Yeah, there's so many different directions to go with that, but my knowledge of movement of my body actually came before dance. It came from martial arts. So that's something a lot of people don't know about me. I grew up around martial arts. My uncle is one of the top martial arts judges in Israel. Shout out Chaim Bachar. And my dad and his whole family, like, they were fighters. Like, that was a huge identity piece of my lineage, I guess. So I grew up in that, and I grew up with breath work and core work and how to hold my body and how to be strong. And so that's a huge resource within itself. I know that you're like obsessed with jujitsu now. And so that within itself is therapy. Like, martial arts and dance and music, like, it's a huge resource. Yeah, there's just so much there that I'm obsessed with, and just the creative aspect of movement and the creative aspect of music and music production. One day I'm going to want to own a music studio, like a recording studio. That's another thing a lot of people don't know about me. I'm obsessed with music production, like beyond obsessed. And so, yeah, there's so much grounding to those worlds that keeps me always feeling supported, always feeling like I can lean on those things for whatever it is that I need at that time in my life. Family is a huge resource. I wouldn't be here literally without family, and I wouldn't be the person that I am without their experiences, their knowledge, their support. And then education is the other big one. I mean, 10 years of my life were spent in post high school education, and then all that obviously before. Since we're 5 years old, we go to school. So I've been in school my whole life. So it's a huge part of my identity. It's a huge part of my psychology, my knowledge base, and it's endless, especially in this world of technology. It's endless, the amount of resources that we have online. So yeah, those are the top things that I can think of.
Yeah, awesome. So we've got music, dance, education, and of course, family. Wonderful yes. Resources to have. So now here comes our time travel question. If Dr. Tom Bachar could go back in time and speak to her 18-year-old father, what would she tell him?
My 18-year-old father. Woo! Where was Abba Itzik when he was 18? That motherfucker was looking fly as hell. He was a badass motherfucker. He was probably just entering the Israeli army. That was probably very liberating for him because he came from a difficult childhood. So what would I say to him? Honestly, I've had so many conversations with Abba about, like, if he has any regrets in life or if he would do anything differently. And he always, like, stands by his answer where he says, no, like, everything happened the way it happened and I loved my life. And despite all the challenges that he's had, I don't know that I would say anything. Like, I feel like his life turned out the way he wanted and the way it is. So there's not really much to say to him other than you're fucking amazing and you created an amazing child. No, that I love him and that he's on the right path and that he's going to do amazing things. Like, I'm speechless. Honestly, I don't really have much to say to him.
All right. Well, yeah, like you said, you were amazing. So the seeds had to come from somewhere.
Yeah, it turned out awesome.
All right. So now, are there any questions you would like to ask me?
I'm so, like, narcissistic. I'm like, how can I make this still about me? Shoot, I feel like there's so much. What are your most difficult psychological challenges? Or what have they been throughout your life?
Most difficult psychological challenges. I wasn't born mindful. And when I think that I didn't even become mindful, maybe even today, I still don't even know if I'm mindful, but at least now I am aware that I was not coming from a mindful place for most of my life. And when you are not coming from a mindful place for most of your life, there's a lot of space for psychological, unbalancing.
Mm-hmm.
So the biggest thing was I spent probably approximately 30 years of my life just being a victim of circumstance instead of creating my circumstances. Our quote says today, you can be in charge but never in control. When you're not working from a place of mindfulness, you think you're in control. When you are operating from a
Right.
place of mindfulness, you realize how much control you absolutely do not have. And that's why you need to be mindful. It's like, okay, because when I use my mindfulness, it gives me back something where I can at least be in charge of the way that I think about things and the way that I behave about things. Kind of circling back to what you said about when you were talking about your client in the corner, and I said the word interrupt, where maybe a better word is disrupt the pattern, because her pattern was that she goes off into the corner and she feels alone. That was her pattern. And we wanted to, or what you were trying to do is help her actually feel it, become mindful of it,
Yes.
so that she can disrupt that pattern and realize, okay, does this pattern continue to serve me?
Right.
And if
Yeah.
it does, I can continue it. If it does not, I need to disrupt it right here, right now, and say, okay, that hurts. That is not awesome, whatever happened to me, whatever I'm feeling. But what is it that I want to feel? Where is it that I want to go? What is it that I do want to manifest? What is it that I want to take charge of? And for about 30 years of my life, I did not live like that.
Mm.
Which means it could have set me up. Imagine if I would have gone another 10 years in that pattern, how much more psychologically, uneven I might be, or I
Yeah.
could have been. I think it comes back to, when it comes to anything psychologically tough, it's what's the story you're telling yourself about it, which is in and of itself mindfulness.
Mm-hmm.
What do you think, doctor?
Dope. It was interesting. It's always so amazing when you ask people questions, because everybody interprets things in their own way, and that's the beauty of humans. I was, in my mind, when I asked that, I was like kind of expecting or assuming that you would point out like a couple specific moments or challenges in your life, and you came from like a very general, like, from this point to this point I wasn't mindful, and from this point to this point. It's just cool to see how we interpret things differently, but that's awesome.
Well, the thing is, being mindful, I think, kind of helps out with not having so much psychologically negative things happen, because you realize that you can control that, or not control it, but again, you can be in charge of if you continue to tell that story to yourself or not.
Right, you can control how you react to the
Yeah, I
situation.
can control if I want to even have that. So, are there things that I need to work on? For sure, always. But much like you said in your post the other day, childlike curiosity. Childlike curiosity keeps you from, getting too deep into psychological mishaps, because kids are usually just happy. And if you can just live life tapping into that happiness, it's only going to give you more of that, because that's the pattern that you start to create.
Amen.
All
A
right.
fucking men.
Now we're going to wrap it up. Let the people know where they can find more Dr. Tommy Bachar.
So I'm only going to talk about my professional references since this is going on public. You can find me on Facebook at Tom Bachar, Tom space Bachar. You can find me on Instagram at Dr. Dr. Tom Bachar. LinkedIn, Tom Bachar. You can find me on my clinic's website. The name of my practice is Systemic Solutions Counseling Center. I'm also on Psychology Today at Tom Bachar, so there's a lot of different cool places. But if you want to find me personally, don't run into my DMs.
Don't run. And I will vouch for the doctor. She is an amazing person. I love her, and I look forward to our friendship continuing and to see how your career continues to blossom. And I think she should be a psychologist comedian, but that's my own
Maybe.
thing. Yeah, maybe. Let's see. Maybe she'll be on stage one day. But if you thought this episode was helpful, please like and share it wherever you can. You can find WEYT, which is WEYT, on YouTube at WEYT Show, Facebook, WEYT, Instagram, WEYT Show. We're on Apple Podcasts. We're on Google Play. We're on Spotify. We're on all the things. Find your favorite way to listen or watch. Give us a like, give us a share if you think there was something valuable that maybe a friend in your circle needs to hear in these conversations. And with that, I will close it with, time and attention is the greatest gift we can give to each other. So here's to spreading more peace, love, and smiles. Later.
Love you.